to learn OBGYN ultrasound? Well, I'm happy to be your host during this course. My name is Daniela Gold. I'm a professor at the Medical University of Graz, and I love to share my experience with you. Welcome to this first free lecture of Gynecological ultrasound. This will give you valuable insights into this so important field. So what will you learn during our first free lecture? We will go through the basics of anatomy and how to perform the standard gynecological ultrasound exam. Ultrasound in the field of gynecology is so fascinating. But for you, it's important to understand that it's crucial to have a solid knowledge of the female physiology to understand and be able to interpret findings both for physiology and pathology. Ultrasound has so much to offer, especially when you're able to perform 3D ultrasound. However, you don't even need 3D to make a diagnosis. Now let's start with the anatomy of the female pelvic organs. Here we see a sagittal view of the female pelvis, and to give you a better understanding on how you can see these organs on ultrasound, I'll show you the topography here. From ventral to dorsal, we see the urinary bladder. Here we see an anteverted uterus with the fallopian tube and with the rectum behind it. On this model, the ovary is a bit more cranial to the uterus. In fact, it's lower than this, but this is just to show you where you could expect it. The ovary is close to the iliac vessels. The ovaries are suspended laterally and posteriorly to the uterus. The supporting structures of the ovaries include the utero-ovarian ligament that attaches the ovary to the uterus and the infundibulopelvic ligament, also referred to as the suspensory ligament of the ovary, through which the ovarian vessels travel. Finally, there is the broad ligament, which condenses to form the mesovarium. So before you start the ultrasound exam, you need to understand what we mean with probe orientation. Every probe has one or more marks which you can feel and see. The mark on the probe always relates to one side on the monitor. Check the position of the probe and if it correctly corresponds to the image on the monitor. Let me show you this in a live video. As usual, we start by putting the gel onto the abdomen. I will perform this scan with the 3D abdominal probe. Every abdominal probe has a marker on one side. The marker on the left corresponds to the correct side on the screen. When we perform a transabdominal ultrasound scan, we start in the transverse plane. If the marker is correctly positioned to the left, the patient's right side will be shown on the left side of your screen. You can check this by pressing your finger into the abdomen to check if the patient's right side is shown on the left part of the screen. In the transverse scan, you move the transducer up and down to scan from cranial to caudal. When you now turn the probe 90 degrees into the longitudinal or sagittal plane, cephalad is displayed on the left side of the monitor. Again, you can check by pushing into the abdomen. For gynecological ultrasound, you can use two techniques. You can either use transabdominal ultrasound or transvaginal ultrasound. There are some cases where you might need transabdominal ultrasound. For example, it gives you a better overview. When would you do transabdominal ultrasound? For example, if you suspect a large mass in the abdomen and you need the view of the entire abdomen. Or some women might not want to have a transvaginal ultrasound. But it does have a few disadvantages. The most important one is that the transabdominal probe has a lower frequency than the transvaginal probe, which means that the image resolution is lower and the quality is not as good. So transvaginal ultrasound not only has the advantage of better image resolution, but also that the quality is not impaired by obesity or gas-filled bowel. But now enough of theory. It's time to show you a demo. So now let's perform a standard gynecological ultrasound exam. When you enter the probe, you start in the midline of the uterus, follow the line of the endometrium to obtain the perfect mid-sagittal view. Then you adjust the image settings, as we have already learned in the previous lecture, so that the organs of interest can be clearly seen on the ultrasound screen. In the mid-sagittal view of the uterus, you freeze your image and then you measure the uterus. We start with the measurement of the total length of the uterus. You set your cursor at the apex of the uterus. In case of an anteverted uterus, you split the uterine length in half so that you measure the total length of the uterus. Next, we measure the anterior-posterior distance by setting the cursor on the outside of the anterior and posterior wall of the uterus. To obtain the transverse measurement, you need to rotate the probe to obtain the coronal view. You will now be able to perform the transversal measurement. In this patient, we see the endometrium in the secretory phase with a nice linear midline and a uniformly echogenic endometrium. When we want to measure the endometrium, we need to make sure that we do this perpendicular to the uterus. Before we proceed to have a look at the ovaries, I want to mention that in this patient we see a little bit of free fluid in the pouch of Douglas. The most common cause for free fluid in the pouch of Douglas is a recent ovulation in fertile women. The next step in the gynecological ultrasound exam is to find the ovaries. We move the probe in the sagittal view to the side and try to find the ovary. In this patient, the ovary can be easily found. In some patients, it might be necessary to turn the probe into the coronal view. We scan through the ovary completely to be sure not to overlook any pathologies. We have now seen the ovary on the left side, and we move the probe to the right to find the ovary on the right side of the patient. Always make sure that you correctly label your images so that the next person can also interpret your findings. For example, always label the left and the right ovary. The ovary has to be measured in 3 dimensions. We start with the measurement in the sagittal view, where we measure the height and the width. The 3rd dimension is measured in the coronal view, and with these 3 measurements you can calculate the volume of the ovary. The same measurements are then taken on the other side of the patient, both in the sagittal and coronal view. Now you have seen how to perform a standard ultrasound examination. Let me just quickly review the landmarks of transvaginal ultrasound findings. In women with a uterus, you might use this organ as a reliable landmark. The myometrium appears as a homogeneous layer of smooth muscle and blood vessels and is less echogenic than the adjacent endometrium. In women without a uterus, you might want to use the bladder for orientation. When you describe the uterus in a report, it's necessary to get the terms right. There are 2 ways to describe the orientation of the uterus. First, there's uterine flexion. Uterine flexion describes the angle between the uterine and cervical axis. Uterine version describes the angle between the cervical and vaginal axis. The uterus can appear on the image the way it is shown here, but it can also be retroverted or retroflexed, and this is important for further clinical management. Finally, let's briefly talk about scanning planes. They help you to provide orientation. There are 3 planes. There's the sagittal plane, the coronal plane, and the axial plane. The most commonly used plane in gynecological ultrasound is the sagittal view. Let me give you an example. Here you see a uterus on a sagittal plane on transabdominal ultrasound. Remember, the uterus is a pear-shaped organ. It appears homogeneous on ultrasound, and it has a hyperechogenic midline, the endometrium. You can usually find the uterus on transabdominal ultrasound. However, it might be more difficult to find the ovaries. Here it's especially important that the woman has a full bladder, like you can see in this image. This is a nice full bladder here that is hypoechogenic, and behind the bladder we see the ovary with little follicles of varying sizes. But as already mentioned, transvaginal ultrasound is the preferred method to perform gynecological ultrasound. Remember, we already discussed the topography of the female pelvic organs. On this schematic, we see a sagittal view with the bladder to the right, the uterus behind, and the bowel. During transvaginal ultrasound examination, the probe is inserted completely, and the cervix will appear in the near field of your image. Let's go through this image step by step. This is the surface of the vaginal probe. We briefly see the vaginal walls. When the transducer is inserted completely, the cervix appears just in the near field, and the uterine body is anteverted and anteflexed in this image. To the right, we see anterior. To the left, we see posterior. So how do we know? The bladder is seen on the right, a landmark for orientation. The endometrium can be seen as a white line inside the uterus, and it divides the anterior from the posterior uterine wall. Of course, the appearance of the endometrium changes throughout the cycle. We will learn about this in the second part of the mini course. But before we finish this lecture, let me show you what the ovary looks like on transvaginal ultrasound. In this moving image, we can see the ovary very close to the vaginal transducer with follicles in different sizes. Next to the ovary, you can see the iliac vessels. These are the landmarks to find the ovaries. In premenopausal women, the ovary clearly distinguishes itself from the surrounding small bowel. Of course, the appearance of the ovaries also changes throughout the cycle. But if you want to find out, you have to watch part 2. Hope to see you there.